Heart and Techy, right and left ventricular hypertrophy, Part 1. In this video first we are going to discuss about right ventricular hypertrophy. Let us see what are the causes of right ventricular hypertrophy. Right ventricular hypertrophy is an abnormal enlargement or pathologic increase in muscle mass of the right ventricle in response to pressure overload, most commonly due to severe lung disease. Because the pulmonary artery is arising from RV, pulmonary artery hypertension, mitral stenosis, pulmonary embolism, cor pulmonale, pulmonary stenosis, tetralogy of Fallot, ARVD are some causes of RVH. If there is RVH, cardiac axis will be shifted towards right. Right ventricular strain pattern will be visible in right precordial and inferior leads. Strain pattern means ST depression and T wave inversion. This is an example for RVH. Dominant R wave are seen in lead V1. Dominant S wave seen in V6. ST depression and T wave inversion are seen in lead V1 to V4. There are some another supporting criterias are there for RVH. These are right atrial enlargement, also called P pulmonale. About this we have already discussed in our previous video, link I will give in the description box. S1, S2, S3 pattern will be present in lead 1, 2 and 3. Next video we will discuss about left ventricular hypertrophy. Thank you. Stay tuned with Heart and Techy. Do like, share and subscribe.